With lap vision, Pajunk is striking out on a new path in laparoscopic diagnostics. Pajunk is one of the world's leading manufacturers of complete medical systems for most applications in laparoscopy, regional anesthesia, organ biopsy and dentistry. As a forerunner among the suppliers for minimal invasive surgery, Pajunk develops both universally adaptable modular concepts together with instruments specifically created for certain fields of application. Pajunk is well known for its high standards in precision and quality. Our innovative balloon system, according to Volland, is a gasless alternative to conventional diagnostic laparoscopy. The intervention can be performed without general anesthetic, not only in the operating theatre, but also in the outpatient setting. The first step is the preparation of the balloon system. The introductory rod stabilizing the balloon is introduced into the balloon system and locked in position. This straightens the balloon, which can then be passed very easily through the port. The balloon can be moistened with a sterile aqueous solution to improve its gliding properties. To lock the stabilizing introductory rod in place, loosen the clamping screw of the balloon system by turning it 1/2 of a complete rotation. The closure of the stabilizing introductory rod is done by rotating it. It is then fixated using the clamping screw. The balloon is now primed. In the second step, the optical trocar is inserted into the flexible sleeve of the port. Then the laparoscope is introduced into the optical trocar. The distal end of the laparoscope is positioned into the atraumatic tip of the optical trocar. The procedure is easily tolerated by the patient, either when fully conscious, but particularly when under deep sedation. For local anesthesia, the fascia is identified by locating it with the needle and then injecting slightly below in the pre-peritoneal space. An approximately 1 centimeter long infra-umbilical standard incision below the navel is sufficient for access. Backhouse forceps are positioned on both sides of the incision, which will allow the raising of the abdominal wall. Perfect orientation at any time. The introduction of the diagnostic port into the abdomen is performed under vision with the aid of the optical trocar. The passage through the various tissue layers can be identified easily. As soon as the peritoneal space has been safely reached, the optical trocar can be easily removed from the port sleeve, and then the optical system can be removed from the optical trocar. The prepared balloon system is now introduced into the port sleeve. The closure must be opened and the clamping screw of the balloon system must be loosened to remove the stabilizing introductory rod. The optical system can be inserted into the balloon system after the stabilizing introductory rod has been removed. The fixation of the optical system is carried out using the clamping screw. Closing the clamping screw will lock the optical system in position within the balloon system, and the balloon system will be simultaneously sealed off. Now the balloon is inflated using a 30 milliliter syringe. A one-way valve will prevent the air from escaping. The balloon is equipped with a 2-chamber system which ensures increased stability. This permits effortless navigation in the abdomen under optimal viewing. The construction of the system optimizes the interpretation of the images. The balloon system can be positioned directly at the location to be examined, and it transmits images of convincing quality. The sensitive optical system is stabilized and protected by the stainless steel shaft of the balloon system. The optical system has an angle of vision of 30 degrees. Focused in the desired viewing direction, it will transfer outstanding images when navigating in the abdomen and in the pelvis minor. Fields of application are second look, for example, for the examination of anastomoses or for follow-up monitoring in cases of peritonitis, in staging laparoscopy, For example, for diagnostic purposes regarding peritoneal carcinosis, and unclear abdomen, for example, the exclusion of an acute appendicitis or of a mesenteric infarct. Further fields of application in gynecology are, for example, obscure ovarian tumors, differential diagnosis of obscure ascites. Additionally, more indications in internal medicine, pediatrics and thorax surgery are possible. Suspect tissue can be extracted for examination during the intervention. The balloon system has a second channel, the biopsy channel, through which flexible biopsy forceps can be introduced. Slight rotational movements of the biopsy forceps will facilitate the emerging of the forceps from the biopsy channel. The biopsy forceps are immediately visible as soon as they emerge from the biopsy channel. The tissue sample can now be dissected and collected. The forceps are then removed. After the examination has been completed, the balloon is ventilated with a 30 milliliter syringe and the clamping screw is loosened. The laparoscope can then be extracted. To remove the balloon system, the balloon must be stretched using the stabilizing introductory rod. This requires the stabilizing introductory rod to be inserted into the system and locked in place using the clamping screw. The balloon system can now be removed. If the intervention has been completed, then the entire system is removed. The port sleeve remains in the abdomen for the second look. It is closed using a sealing stylet, then sutured to the abdominal wall. The port sleeve is closed up by introducing the sealing stylet and locking it in position at the port. The flexibility of the sleeve and the rounded flexible end of the sealing stylet protect the abdominal cavity from injuries by the port. The flat seal is small, ensuring optimal comfort for the patient. The balloon system can be used outside the operating theatre environment without problems. As no pneumoperitoneum is required, and therefore no general anaesthetic, this simple procedure with less effort offers substantially reduced costs. Lap vision is the breakthrough in laparoscopic diagnostics. High diagnostic certainty and safety with minimal risks for the patient. You can find the complete product program of Pajunk at pajunk.com. Lap vision, the laparoscopic diagnostics of the future.